My name is Shea. I am a PhD student at King's College in the War Studies Department, and I'm also a non-resident scholar at the Middle East Institute, where I focus on the impacts of technology across the Middle East and North Africa, with a specific focus on Egypt. So today in this presentation, I'm going to present the results of a survey that I did with the World Bank starting last December in December 2020. And this was a study that we conducted over the course of 7 months into vaccine misinformation, disinformation, and conspiracy theories on Twitter in the Middle East and North Africa. So I'm first going to present the methodology of this study and go over our preliminary findings and results, and then I'm going to discuss more broadly government and social media policy towards dealing with COVID vax mis and disinformation. So let me just see. So first and foremost, our main research questions were focused on, number one, can we use Twitter data to monitor attitudes towards COVID vaccination? And more broadly, who are the most effective messengers of COVID mis and disinformation on Twitter? And what are the most effective messages used by these camps of people? But I think the first question I'm going to flag to begin with is important. Is Twitter even a useful tool to identify attitudes and mis and disinformation? Over the course of the study, we found it was helpful for identifying certain kinds of conspiracy theories, but understanding attitudes more broadly, it has its limitations. So I'm first going to just go into our methodology a little bit. So starting last December, we used Twitter's open API to download tweets with prominent COVID hashtags and COVID-related vocabulary in Arabic. We soon found that there weren't that many trending hashtags specifically related to COVID or COVID vaccination, so we expanded that to include COVID-related vocabulary more broadly, COVID vaccination vocabulary more broadly, and not specifically focused on hashtags. And so we had 2 main periods of data collection, and we were actually quite lucky because when we started this project, it was before any sort of major vaccine rollout had happened throughout the Middle East and North Africa. So we were really able to observe how attitudes first reacted to the creation and rollout of vaccines and whether or not they changed over time. So our first period ranged from mid-December of last year until mid-February 2021. And we gathered approximately 730,000 tweets from approximately 230,000 user accounts. And our second data collection period ran from late February to early April. So I won't get into the nitty-gritty of how we analyze the data. I would be happy to share our full paper, but there's just not enough time right now. But I'll sort of go very generally into how we identified attitudes using this data set. So basically, it was my very glamorous task to go through hundreds of influencers' accounts that we had scraped and manually review their accounts to see what their expressed attitudes were towards COVID vaccination. And so I hard-coded hundreds of these influencers by either being anti-vaccination, pro-vaccination, or neutral. And I want to note, and this is an important methodological choice that we made in regards to how we define these terms that will be important later on. So we only categorized accounts as anti-vax or pro-vax if they had explicit and overt sentiment towards that. So if they explicitly rejected the vaccine, that was categorized as anti-vax. If they explicitly were pro the vaccine, that was categorized as pro-vaccination. But it had to be an explicit and overt endorsement or not endorsement. And I'll come back to why that's important later on. So in addition to identifying whether accounts were pro, anti, or neutral towards vaccination, we also identified different arguments, and we tried to typologize them sort of in relationship to other studies that had looked at different kinds of conspiracy theories around vaccination, and sort of see what kind of arguments both camps were making in regard to the vaccine. So it's quite small here, my apologies, but we came up with about 14 pro-vaccine arguments that were prominent in the accounts that we analyzed, and we identified 17 pro-vax arguments and about 14 anti-vax arguments. And again, I manually coded individual accounts as pro, anti, or neutral to the vaccine, and I also hard-coded a number of individual tweets corresponding to this list of arguments. And so an individual tweet didn't necessarily only need to have one argument. There could be multiple arguments implicit in a tweet. And so I, again, had the very glamorous task of manually going through thousands of tweets and hard coding them according to this legend that you see right here. So our first question, looking at this data, was, how large is the anti-vaccine sentiment on Twitter and MENA? And as you see from this graph, our initial findings showed that only about 3% of Twitter accounts demonstrate anti-vax attitudes. And again, remember, this is overt, explicit anti-vax attitudes. And 89% of accounts demonstrated a pro-vax view. So the green is the positive and blue is the negative. So it seemed quite low, especially in sort of relation to other surveys that we had looked at. 3% of anti-vax attitudes was sort of suspiciously low. So we were curious as to why we had this result. And when we looked into the data more deeply, we realized that I also had the task of hard coding accounts according to what kind of accounts they are. So were they individuals or were they organizations? And so when we were asking this question of why does anti-vax hesitancy seem so low, we realized that Twitter, there's not only people on Twitter, but there's also organizational accounts. And so we realized that vaccine hesitancy was much more prevalent on individual accounts rather than organizational accounts. So when only considering accounts belonging to people, our estimate of vaccine opposition or vaccine anti-vax sentiment increased to about 19%, which is similar to other studies that we had looked at. And our sort of theory of the case as to why individuals were much more vaccine, anti-vaccine than organizations. We sort of felt that organizations are more likely to express overtly positive attitudes towards global vaccination, just because, more often than not, they're NGOs, they're news organizations, they're official government bodies that have accounts on Twitter. And even, if an organization may be anti-vax themselves, they may be much less likely to express this attitude as their, official organizations take on Twitter overtly. So this was one of the more early interesting findings that accounted for this, initially low finding of anti-vax attitudes in our data set. So yeah, here's here's the sort of difference in breakdown when we account for vaccine attitudes for all accounts versus vaccine attitudes for only individuals. And so you see that the prevalence of anti-vax attitudes only for individuals increases quite significantly. So another question that we had was, how effective is messaging on both sides? How effective is anti-vax messaging and how effective is pro-vax messaging? And what we found is similar to many other studies on social media polarization. It was that which basically we found that anti-vax accounts had a smaller number of followers compared to pro-vax accounts, but these anti-vax accounts receive a comparatively larger number of retweets for their given number of followers. So basically, while the anti-vax numbers may be small, they are quite, effective in the reach of their messaging. This maps on, as I said, quite well to other studies that have been done using social media to sort of assess polarization of attitudes. So, basically anti-vaccine content can circulates much more aggressively within its self-contained echo chamber. And sort of what we found is exactly this, is that even though it's a smaller number of accounts and smaller numbers of followers, the power within these echo chambers is much, much stronger. And so then we sort of looked at how sort of the most effective arguments used by anti-vaxxers, and again, sorry, it's a bit hard to see, but the most effective arguments that anti-vax accounts used were they sort of pointing to people who had died after taking a vaccine, encouraging other treatments, sort of natural treatments, or just going for a run. Another prominent conspiracy theory and attitude that was associated with anti-vax was sort of broad distrust in world institutions and belief that COVID is a hoax or just exaggerated. There was lots of sentiments of elite skepticism as well, sort of believing that, again, COVID is a hoax and is a sort of conspiracy among the elites to enrich themselves through big pharma and whatnot. So those were the largest numbers of arguments that we identified in the anti-vax camp. So the pro-vax, the most effective argument by far that was used was a sort of using celebrity or well-known public figures to promote the vaccine. And the tweet that I saw maybe 1 million times over the course of doing this study was watching MBS take his vaccine. And this just went hugely viral. And it is quite indeed an effective tool in encouraging vaccination. And in other studies on public health, it's come up time and time again how effective using popular figures is to encourage vaccination. There was also a lot of messaging around sort of vaccine patriotism. So, for example, it's your duty to go out and get the vaccine. There's also a lot of messaging, obviously, around vaccines being safe and effective, giving out sort of sound scientific medical information about how the vaccine works. That was very prominent as well, stressing as well that the vaccine was tested and reviewed. So yeah, this is very generally the breakdown of the most effective arguments that we identified. And again, overwhelmingly, the use of celebrities and popular figures was the most prominent in our data set. Finally, we looked at who the most effective messengers are and sort of what accounts got the most retweets and had the biggest reach. And by far, it was state news organizations. And we can sort of discuss what this means, really. And I think my instinct was that state news organizations already have, a base and quite a large following. They're going to be retweeted by their respective government agencies. They are, depending on what kind of state we're talking about, can be more or less trusted by the population. But most broadly, state news organizations had the largest reach in the data set. So those are our a very brief overview of what we looked at in our results. But I think I want to go back to what are the limitations of using Twitter data as a source of understanding attitudes towards public health more generally. So I pointed to this when I identified how we defined our terms in regards to anti-vax and pro-vax sentiment. So when I was hard coding these Twitter accounts, I only was able to code anti-vaccine hesitancy or anti-vaccine sentiment or pro-vaccine sentiment if the sentiment was overt and explicit. And this does not account for vaccine hesitancy, which is, maybe someone's attitude that they won't express overtly online. And so this is a big limitation of using something like Twitter data to assess attitudes online. So it misses the hesitancy that can be created by conspiracy theories. And, folks who are sort of in that middle ground, who may be hesitant to take the vaccine, but may not be, so anti-vax as to express those attitudes expressly online. So this is an important limitation to keep in mind. Another thing is, obviously Twitter data is used by researchers very often because it's extremely accessible. If you know how to plug into the Open API, you can access it with relative ease. But I think it's also important to keep in mind that the population that is on Twitter is not necessarily representative. Obviously, in a place like Saudi Arabia, you have huge numbers of the population on Twitter, but in Egypt, it's very different, Lebanon, Iraq as well. So it's important to keep in mind that not everyone is on Twitter. It's not necessarily the most representative platform. So yeah, I think this can be used as a tool to sort of generally have an idea, a low-cost solution when you can't do surveys in certain contexts where it may be difficult to speak to people. And I think that, what we can learn about the sort of difference between effective messaging and the prevalence of organizations to have pro-vax sentiment and individuals to have anti-vax sentiment those are still somewhat, interesting observations that we were able to glean from this survey. I guess right now I'm going to ask if anyone, number one, has any questions in regard to these results, and then if not, I will sort of talk a little bit about government policy towards government and social media policy towards vaccine mis and disinformation in the Middle East. Any questions? I'll wait a little bit. So one question on coding the tweets as per the legend, why was it not done manually and not via a tool? So we really, for my sake, we really did want to develop a tool, but it just was impossible given the subtlety in language of how certain individuals or even organizations for that matter will express these attitudes. We tried to use certain keywords, so maybe QAnon or Bill Gates. There's sort of been some keywords to filter for anti-vax sentiment, but it became we weren't capturing everything that way. And yeah, as I said, the subtlety in language that some people will use to express their attitude was such that it limited our ability to develop a tool. And I think especially because obviously most of the tweets we were looking at in Arabic were in Arabic, it was the sort of ability of our data scientists to develop language identifying tools in Arabic was really difficult, especially given our time frame. So I had to do it manually, which was lots of fun. Any other questions? If not, I'll sort of discuss more broadly government policy. So, at this point in the pandemic, we all have some idea of what good public health messaging looks like, clear science messaging explaining how vaccines are safe and effective, tackling conspiracy theories and rumors head on, being very proactive, in your efforts to communicate to hard-to-reach populations, impoverished areas, folks living in informal settlements. We know what steps governments can take to dispel conspiracy theories and disinformation to the best of their ability, and also proactively disseminate positive public health messaging. I think particularly in the data set that we looked at, one big gap that was happening in and still is in the Middle East is the lack of accountability for social media companies to moderate content adequately in Arabic. This study, as I mentioned, began last December, and we finished the data collection and coding late spring, early summer. And even, when we're verifying some of the coding that we had in late spring, tweets and accounts that were talking about Bill Gates and these very well-known anti-vax conspiracy theories that I had tagged and coded months before were still online and still active. And I had sort of thought that we would, because Twitter had promised to take on conspiracy theories and disinformation head on, that we would run into a problem where we would be losing access to valuable data. And that was not a problem because it was up there for months. And I wouldn't be surprised if I even went back to some of the accounts that we had tagged as anti-vax, if they were still up and still spreading this kind of content. So I think that was one of the most glaring observations from a policy perspective, was just how little content moderation Twitter was doing in regard to conspiracy theories and misinformation in Arabic. Most of what we looked at was in Arabic. I haven't done a comparative study in English, so I'm not sure how quickly that content would be taken down if the study had been looking at English content, but my suspicion is that it would be taken down a lot quickly, or a lot faster than what was happening in Arabic. In terms of government policy, the case that I'm most familiar with is Egypt, and I think one of the most sort of glaring mistakes that was made in the Egyptian government's ability to communicate effectively about rumors and conspiracy theories, like actual rumors and conspiracy theories around the vaccine, was, their broader distrust in the population and in the information that is being released from the state. And I think that this could not have been more obvious than, the release of the COVID daily numbers. These numbers were so low every single day that, most people just sort of took them as a joke, and they were just so, different from what people's own personal experience of their friends and families getting sick, that they just, couldn't trust these numbers. And we realized that this was actually not just in our heads, but the World Bank came out with a report in October that said that Egypt was ranked 5th in the world of countries to underreport their numbers of deaths, and it was the top country in the Middle East. And again, this is not surprising, but I think that, those consistently low numbers, just bred this general distrust in the kind of information that was being released by the government in regard to the pandemic. And you can't trust the numbers if they're trying to spread good, sound scientific information about the vaccine. How is the population going to choose one or the other? And of course, trust in government takes years to build. And one of their own policies towards containing rumors and disinformation is arresting people for spreading false news. At the beginning of the pandemic, they amended the emergency law to include, spreading false news related to a pandemic. And when the emergency law was lifted in October last week, the House of Parliament passed its own separate bill related to pandemics and health measures, and this, criminalization of spreading false news was in there as well. And of course, the crime of spreading false news is not only in this public health law, it's also in the penal code, it's in the cybercrime law, it's in the media regulation law, and it's obviously used more broadly to crack down on freedom of expression and arrest peaceful activists. And this was, these articles were also used as a way to combat misinformation and disinformation. And, of course, it's not an actually effective tool in combating these things, and it's just being used as a tool for state repression. So we're running out of time. I'll ask one more time if there are any questions, and if not, I will wrap it up there. As I said, the report is available, so if you're interested in the methodology or anything else, I'll be happy to share. Just get in contact with me. Any other questions? I'll just wait one more minute. Okay, well, if there's no more questions, I will leave it at that. Thanks so much to the organizers of Bread and Net. I love this conference, and yeah, I'm excited that it's happening again, and hopefully see you guys all around the next 3 days. Okay, take care, bye-bye.